The heart has an electrical system that regulates the heartbeat. Sometimes the electrical signals don't work properly. It can result in a heart failure and life-threatening abnormal heart rhythms. Ventricular fibrillation happens when electrical signals in the ventricles become very rapid and chaotic. As a result, the ventricles quiver and are not able to pump blood to the lungs and the rest of the body. It can happen during or after a heart attack, which often results in a sudden cardiac death unless the person gets instant emergency medical care. In manual defibrillation, the paramedics control the defibrillation process, using external paddles. After assessing the patient and determining that defibrillation is necessary, connecting the paddles to the device, and applying the paddles to the patient's bare chest, set the defibrillator knob to the desired energy for the patient. Then, press the charge button on the paddle. The red shock buttons on the paddles flash to indicate the defibrillator is charged. The patient contact indicator lights turn green once proper skin contact is made. Press shock buttons simultaneously located on the paddles to deliver the shock. Upon delivery of the shock, the heart interpreter announces "shock delivered." Following a successful defibrillation, the joules delivered are displayed and the shock counter will increment accordingly. After a successful defibrillation, and after you confirm a stable heart rhythm, return the defibrillator knob to monitor. The elements of defibrillator are transformer, diode to rectifying the output of the transformer, capacitor to store charge, switch, current limiting inductor to protect the patient, and the patient's heart. First, the transformer will charge the capacitor until the capacitor is fully charged. After the doctor press the button, switch will change, and the capacitor will lead the charge to the patient. If you find someone unconscious, unresponsive, and not breathing well, he is having a cardiac arrest. The electrical signal in his heart stopped working as it should. The lack of blood and oxygen to his brain causes his brain cells to die, and there are no doctors in the place to give him a shock by manual defibrillator. The automated external defibrillator, AED, will assist the heart rhythm. It will tell you, shock advised, only if a shock is needed, and won't cause any harm. The AED will try and reset the electrical system in the heart to get it beating normally again. When using with CPR, defibrillators give the best chance of survival. AED circuit based on synchronization. Electrodes are used to read ECG signal, then detect P, Q, R, S, T wave to know when R wave appeared to trigger a time delay circuit of discharging. In this case, the switch is automatically synchronized with the ECG signal reads. In some cases, patients have a high risk for life-threatening ventricular arrhythmias. Therefore, they need an Implantable Cardioverter Defibrillator, or ICD for short. ICD has a role in avoiding cardiac arrests and preventing sudden deaths. It constantly monitors the heart. If it detects the dangerous abnormal rhythm, it will deliver small electrical impulses to try and get the heart beating normally again. If it doesn't work, it will then deliver shock therapy to try and restore the heart back to a normal rhythm. ICD is a small implanted device. It's only the size of a small matchbox, and weighs about the same as 3 AAA batteries. In an emergency situation, knowing how to use a defibrillator could save someone's life. Knowing how a defibrillator works can help you act more effectively in a stressful situation. For every minute it takes for the defibrillator to reach someone and deliver a shock, their chances of survival reduce by up to 10.